Welcome to our presentation. Our women's health topic is eating disorders and our indigenous topic is smudging. We will begin by defining smudging and the four main herbs used in these ceremonies, as well as describing why it is important for indigenous communities. In our women's health topic, we will first describe what an eating disorder is, then we will talk about current treatments, then discuss why this is a women's health issue by talking about how it affects women, before finally talking about nursing implications. Smudging is a healing ritual that is used to purify and heal its participants by using sacred herbs and smoke to cleanse both the person and the area of negative spirits and emotions. These sacred herbs, such as tobacco or sage, are placed into a container and ignited to create smoke. The smoke is then wafted over the person or the area using either an eagle feather or their hand. The person inhales the smoke to cleanse themselves. After the ceremony, the ashes are returned back to earth by placing them on the ground as a symbol of gratitude. There are four main herbs often used in a smudging ceremony. Firstly, tobacco. Tobacco is used in every ceremony as it is used to create the smoke. More importantly, tobacco is used to declare your intentions for the ceremony and therefore facilitates communication with the spirits. Second, sweetgrass is used for purification purposes. This herb is often braided into 3 strands, which signify love, kindness, and honesty. Thirdly, sage is used for its restorative properties. It also helps to purify negative thoughts and emotions. Finally, cedar is used to call the attention of the spirits, which allows for communication and attraction of good spirits. Smudging is important for many indigenous communities and can be a way to honor traditions of previous generations. As mentioned, it is used to purify negative emotions and in turn encourages positive spirits and positive energy, which helps to heal the person partaking in the ceremony. By partaking in a smudging ceremony, participants are offering their blessing to Earth as they honor the sacred tradition. Finally, it is used as a way to prepare a person for a future spiritual experience. For example, this tradition is often used in palliative patients as a way to ensure a peaceful transition and a renewed faith during this painful and difficult time.
The American Psychiatric Association defines eating disorders as illnesses in which people experience severe disturbances in their eating behaviors and related thoughts and emotions. Eating disorders typically present with anxiety, panic, obsessive-compulsive disorder, and substance abuse problems. The 3 most common types of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. According to the American Psychiatric Association, anorexia nervosa is diagnosed when patients weigh at least 15% less than the normal healthy weight expected for their height. Those diagnosed with anorexia nervosa limit their food intake, have a fear of being fat, face problems with body image, and are in denial of their low body weight. When patients refuse to eat, exercise excessively, and use laxatives or force themselves to vomit, they are unable to gain weight. The body will then go into starvation mode, and the patient may present with decreased blood pressure, pulse, respirations and temperature, amenorrhea, osteoporosis, anemia, constipation, and lethargy. Those diagnosed with bulimia nervosa may appear to be somewhat underweight, normal weight, or overweight. The American Psychiatric Association states that patients regularly binge eat, often consuming thousands of calories that are high in sugars, carbohydrates, and fat. After binging, patients may purge by forcing themselves to throw up or take laxatives. It may not be obvious that someone is living with bulimia nervosa because they may not appear to be severely underweight. Patients diagnosed with bulimia nervosa may present with an inflamed throat, severe dehydration, thinning tooth enamel, gastroesophageal reflux disorder, and a puffy face resulting from swollen salivary glands in the neck. Patients diagnosed with binge eating disorder typically consume substantial amounts of food within a short period of time and feel loss of control while doing so. They do not rely on compensatory mechanisms to get rid of the food they consumed, which may cause obesity, diabetes, hypertension, and cardiovascular disease. Patients living with binge eating disorder may eat rapidly, eat until they feel extremely full, eat excessive amounts of food even when they are not hungry, or feel depressed and guilty after an episode.
Treating eating disorders. Behavioral strategies are the most researched and most evidence-supported methods for treating symptoms that are present in individuals who have eating disorders. Treatment is usually disorder-focused. So first we have anorexia treatment. In treating anorexia, the key is to help patients to gain a healthy weight. The first step is nutritional rehabilitation. Anorexic patients are severely underweight and malnourished, so the goal is to undo this issue. Nutritional rehabilitation often involves the individual getting a specified amount of weight per week in order to meet nutritional requirements. It is preferred that this is done by the individual orally consuming food and or supplements such as Boost or Ensure, but if this is not possible, then it may be done through mechanical tube feeding. Family therapy is also considered to be effective, especially for younger or adolescent patients. Parents are encouraged to help the child to eat more. Support groups can also be helpful for the social aspect so that patients know they are not alone in facing this issue. And lastly, we have structural inpatient or partial hospitalization programs. These are for more severe cases of anorexia where treatment mentioned above have not been effective. Individuals are hospitalized or they're in day programs and they have to follow strict schedules. They must eat specified amounts of food in allotted time periods and it's often supervised. Weights are constantly monitored, however, patients are usually not allowed to know them. And as progress is made throughout their time in this therapy, restrictions gradually become loosened. Next, we have bulimia specific treatments. The key to treating bulimia is interrupting the binge purge cycle. So often this is done through individual therapy. So cognitive behavioral therapy is the most common one. It helps the individual to change unrealistic thoughts that they have about their appearance and change their eating habits. CBT is based on the idea that thoughts affect behavior and behavior affect thoughts. IPT, or interpersonal psychotherapy, helps the individual to improve the quality of their relationships and learn how to address conflict and find healthy coping mechanisms. Group therapy can help the individuals to deal with the shame surrounding their illness. And lastly, support groups help them to have peer-based feedback and an understanding support system. Lastly, there's binge eating disorder. So the key for treating this is to stop the person from binging. There's much debate about whether the psychological aspect or the weight loss aspect should be treated first. Usually, nutritional rehabilitation and counseling is the first step by eliminating binging and helping individuals to increase their self-esteem and acceptance of their bodies. It is important to treat any underlying conditions such as depression or anxiety that often exist, and by addressing their psychological issues, individuals will feel better about themselves and therefore stop eating, which in turn will lead to weight loss. There's also individual therapy, again, cognitive behavioral therapy and interpersonal psychotherapy. CBT is shown to be effective in terms of both speed and long-lasting effect. It's especially used for binge eating and bulimia. However, it's considered to be demanding in terms of resources when compared with other treatments. As for any other medical condition, research on treatment is always evolving. For eating disorders, the most recent research is looking at psychopharmacological treatments. Currently, the only medication indicated for treatment of eating disorder is fluoxetine. Fluoxetine is a selective serotonin reuptake inhibitor, or an SSRI, and it's indicated for the treatment of bulimia. Other SSRIs, as well as tricyclic antidepressants, have been used in clinical studies to test the effectiveness in the treatment of anorexia. Unfortunately, there has not been enough evidence to support their use, as they have not shown usefulness in restoring weight or preventing relapse. However, they may be useful in improving depressive or obsessive compulsive symptoms that commonly occur in anorexia and other disorders.
Now we are going to talk about why eating disorders is a woman's health issue. Some of the risk factors that are related to social structures and position, such as gender, social class, age, or ethnicity. Some women face different emotions of weight concerns which lead to dieting and negative body image thoughts. This usually results in internalization of thinness, negative affectivity, or perfectionism. Eating disorders usually present more in young girls than women. Women face greater rates of exposure due to violation or harassment, which emphasizes their appearance to obtain higher social power, and gender harassment. Women face greater rates of exposure due to violation or harassment, which emphasizes their appearance to obtain a higher social power, and gender harassment. Adolescent females are influenced by peer norms of weight and weight-related concerns, as well as peer relationships by comparing themselves to one another. Health promotion directed at women often relies upon gender norms and appeals to attractiveness as opposed to health. They may shame or blame women for not fitting into health standards as opposed to supporting them in health. There's a belief that weight shaming is justifiable as it may help motivate women into adopting their healthier behaviors. Certain health promotion strategies that blames and shames health may cause women to adopt disordered eating behaviors and adhere to the ideal body type.
Media exposes adolescents to weight loss strategies to achieve the ideal thinness that is portrayed in photoshopped advertisements. Many women try to achieve the goal weight through poor and sometimes dangerous nutritional choices. A lot of cultures pressure women to be thinner than what is required for optimal health. When pre-existing mental health concerns such as anxiety are controlled, the perception of body image that the media portrays is often diminished. The media plays a huge role in influencing body dissatisfaction and eating pathology in women. Self-objectification has facilitated a connection between internalized appearance ideals and drive for thinness. Negative emotional experiences and eating disorders were found in connection with cultures that sexually objectify the female body. Women try to improve their bodies through dieting as a basis of gaining control from a perceived belief and lack of self-control or power. Adolescent females are 2.5 times more likely to develop an eating disorder, more commonly bulimia nervosa, after experiencing sexual abuse. When women are not able to cope with difficult emotions, it may be a contributing factor in the onset of eating disorders in female adolescents with a history of sexual abuse. Disordered eating may be adopted by survivors of sexual abuse as a way of changing their body type to prevent future abuse, and can be also a coping strategy to decrease anxiety, cause numbness, or avoidance.
Nurses must have the knowledge and resources to recognize when they have a patient suffering from an eating disorder. Eating disorders do not always present as, for example, a 90-pound 14-year-old girl who looks severely malnourished. As you can see on the picture on the right, eating disorders can be found in all shapes and sizes. Oftentimes, it can be a young woman who is at average weight secretly battling bulimia, anorexia, or binge eating disorders. Nurses can encounter women and girls with eating disorders at any point in their career. They may enter the healthcare setting with a separate health concern, and nurses must be prepared to care for them holistically. If we fail to recognize or care for an eating disorder, it can prevent healing of other comorbidities, which in turn can prevent discharging and lengthen hospital stays. All nurses must have knowledge on mental health issues to ensure young women are receiving the appropriate care. One implication for nurses that needs to be analyzed is the use of mechanical feeding on patients with eating disorders. Mechanical feeding often occurs with young girls who don't have the capacity to make their own decisions and are refusing all other forms of treatment. Nurses are forced to use nasogastric tubes on these patients in an attempt to keep them alive. Nurses spend hours talking and working with their patient to then turn around and restrain them to shove a tube down their throat an hour later. In the Pinto article, nurses describe the ethical dilemmas they face with being what is described as a carer on one hand and enforcer on the other. Many of these patients have a history of sexual abuse, and then you have a pile of strangers entering their room to pin them down against their will, which can only exemplify their traumatic past. Nurses struggle to feel like they're doing a good job, and any sense of trust built is suddenly gone. This method of saving a life is so dehumanizing it can drastically not only affect patients but also nurses. Nurses spoke about developing PTSD around tubing experiences and the burnout that can come with working with young girls battling an eating disorder. Some have taken so many sick days to simply avoid the tubing experience that comes with mechanical feeding. Nurses pursuing a career in mental health or who intend to work with women suffering from an eating disorder need to be aware of the potential ethical issues that come alongside. Nurses who are caring for patients with an eating disorder must recognize the complexity of each woman and the intersectionality of their lives. The underlying cause of their illness must be identified in order for treatment to be effective. As an example, a woman with a history of sexual abuse may have an eating disorder to feel like she is in control of her own body. If therapy and treatment of her traumatic past is not cared for, her eating disorder will continue or transfer into another form of self-harm. Each woman leads a different life and comes from a different racial, cultural, socioeconomic, political, educational, and family background. There are so many factors that can lead to a woman or young girl to suffer from an eating disorder, and it's vital as nurses we use our knowledge, skills, and judgment to identify and treat based on this. When health promotion policies take health risks that are different in men and women and these unequal power dynamics into account, they are more likely to be successful in promoting health. Nurses should analyze these gender inequities and how they affect health before creating policy interventions that promote health. When examining health promotion and eating disorders, we should consider gender as a high-risk factor and should therefore aim to counteract the range of intersecting factors that occur in young women's lives. Health promotion should allow for equity, safety, and mentoring that allows for women to become empowered and to think critically about body weight and shape preoccupation.
Thank you for watching a presentation. I hope you learned lots of new information and I hope you enjoyed it.